Hello, my name is Bibiana Kemerer, and I'm a graduate student at the University of British Columbia. My lab, UBC's Sexual Health Lab, recently completed a clinical trial where we saw how mindfulness and cognitive behavioral therapy improve sexual health and intimacy in couples after prostate cancer. These therapies can help you with your prostate cancer journey, and today I'm going to talk to you about the benefits of them, as well as how you can practice these therapies at home on your own at no cost to you whatsoever. Sexual dysfunction is a common experience in all stages of the prostate cancer journey. This can even happen right after diagnosis. As well, almost all men experience some level of sexual dysfunction after their treatments. If you've been in the prostate cancer supportive care program for a while, you're probably more than likely familiar with the many sexual aids that can be quite effective at treating erectile dysfunction. However, when we think about the psychological aspects of this dysfunction for both survivors and their partners, this might not be adequately addressed. Couples can experience feelings of anxiety or stress surrounding intimacy, or frustration that sexual intimacy is not where it once was, and these can also affect both the survivors and the partner's self-esteem. These feelings can further impair sexual functioning, taking couples farther away from the satisfying sex lives that they want to be having. And the whole journey in general can be quite stressful. It's not uncommon for both partners to experience feelings of intense worry, anxiety, depression, and fear surrounding the diagnosis and treatment process. Psychological therapies can help couples develop skills and gain tools to cope with and adjust to these feelings and changes in sexual function after prostate cancer. These skills can help couples manage negative and distressing thoughts and feelings surrounding the prostate cancer journey as well. So my goal today is to introduce you to two therapies, mindfulness and cognitive behavioral therapy, that have been effective at accomplishing just this. So what is mindfulness? Mindfulness can be simply defined as present moment awareness that is non-judgmental. And we can do this and achieve this by focusing our thoughts on something that is in the present, for example, our breathing. The goal of mindfulness is to stay present in the moment by recognizing our feelings, both physically as well as our thoughts and emotions, and doing so in a way that places no meaning on them. Just recognizing them and accepting them as they are. Other practices such as meditation, yoga, or a walk outside may also bring about this state of present awareness. However, mindfulness is a little different. It's more specific. Although there are many mindfulness meditations to teach us these skills, which I will describe later. Other studies have looked at mindfulness for prostate cancer survivors, and what they found is that for these survivors who practiced mindfulness, they had reduced anxiety and distress related to their diagnosis and improved quality of life. Mindfulness also helps survivors maintain healthy goals after their treatment, so it helped them maintain healthy dietary changes and also healthy exercise goals. So overall, mindfulness helped them keep up with healthy living after their treatments. Cognitive behavioral therapy, or CBT for short, involves identifying and challenging our negative thoughts and behaviors. The goal of this short-term goal-oriented therapy is to reframe our thoughts in ways that are more productive to us, improving our mood in the long run. Studies have found that practicing CBT has helped prostate cancer survivors cope with their symptoms after treatment. These included night sweats and hot flashes after hormonal therapy, lower urinary tract symptoms, and has even helped these survivors manage fatigue. CBT has also been shown to help improve prostate cancer survivors' self-esteem after treatment. So our lab decided to look at how couples' sexual, psychological, and relational health was impacted by 4 weeks of either group mindfulness therapy or group cognitive behavioral therapy. What we found is that couples who practiced either cognitive behavioral therapy or mindfulness had less distressing and anxious thoughts surrounding their sexual intimacy long-term after these therapies had ended. This was up to 6 months afterwards. And prostate cancer survivors also had short-term improvements to their sexual satisfaction. As well, couples who practiced mindfulness or CBT also had short-term and long-term improvements to their quality of life. So now I'd like to talk to you about the actual tangible benefits of these therapies and how they can help you. So the first is that mindfulness is really good at reducing stress. It does this by soothing the brain areas that are responsible for fear and emotion. So, in other words, it actually targets stress at the source, stopping it before it even starts. This can be really important for something like waiting for your PSA results or maybe any long-term stress that you're dealing with after treatments. And in terms of sexual function, this is very helpful because stress hormones actually interfere and block our sexual response. So by managing our stress, we're actually improving or increasing the likelihood of maintaining and achieving physical sexual arousal. Mindfulness can help survivors cope with their diagnosis and help partners cope with the anxiety and fear related to this diagnosis. Mindfulness is great at improving mood, which is great for our sexual function. One of the key components of mindfulness is that it reduces the impulse to focus on the future, worrying about all the possible things that could go wrong, which is highly stressful to the body and can be detrimental to both our mental and physical response. And finally, the real crux of mindfulness is that it allows one to appreciate the present experience, to be here rather than to be lost in thoughts somewhere else. This can mean an intimacy to be more aware of your sensations when you're interacting with your partner. Mindfulness also really allows you to be grounded in sexual intimacy rather than to be caught up somewhere else in your distressing thoughts. Cognitive behavioral therapy has a lot of similar benefits to mindfulness. The first is that it's a great therapy for reducing stress and anxiety, whether, again, this be stress in the moment or chronic stress. It's also found to help both survivors and partners cope with the diagnosis. Cognitive behavioral therapy is actually a fantastic therapy for improving mood. In fact, it's been repeatedly found to be just as effective as antidepressant medication for treating depression. In terms of sexual function, cognitive behavioral therapy can help add flexibility to sexual beliefs, especially if those beliefs are rigid or inflexible, because these unrealistic expectations for sexual intimacy are highly stressful to our body and, again, are detrimental to our sexual response. So cognitive behavioral therapy can help challenge and stop those unrealistic beliefs. Learning this therapy quite similarly can stop us from having negative thoughts during sexual intimacy, which can then help us focus on the experience. And in general, it can help us stop having these negative thoughts in our day-to-day lives. I'd also like to include this slide to demonstrate that our lab is actually better known for our research in mindfulness in women. And this study is actually one of our few studies that focuses on mindfulness in men. So if you are someone who identifies as a woman and you are a partner to a prostate cancer survivor and you also experience your own sexual problems or dysfunction, or you're just wondering what mindfulness can do for you, I'd like to share a little bit of finding from the research we've done in our lab. So the first is we found that mindfulness improves and helps women cope with experiences of pain during sex. And it also has found to improve sexual response in women with gynecological cancer. For women who experience low desire, mindfulness actually increased their desire and arousal. In all these samples, mindfulness was very effective at reducing feelings of distress around sexuality. So we've provided some online resources for you to access to practice these therapies. They are totally free and they involve no treatment or procedure whatsoever. You can choose to try one of these therapies or both. Both have good benefits. Mindfulness therapy involves more so consistent meditation practice, whereas cognitive behavioral therapy involves doing some worksheets and reading. So you may want to pick what's best suited to you based on that. So first I'm going to talk about mindfulness. The goal of practicing mindfulness is to develop attention training along with non-judgment. There are two ways to practice mindfulness. One is formally through audio recorded meditation practice, and the second is informal mindfulness, which involves being presently aware while doing a familiar task. This can involve, while doing this task, really feeling the sensations, what do you smell, what do you hear, and also what are your thoughts and emotions while doing that task. So to really get the benefits of mindfulness, I recommend by starting with one meditation a day and also trying to keep up with this daily meditation. For informal mindfulness, I recommend doing 10 minutes a day while doing a familiar task such as your dishes, folding your laundry, or going for a walk. And when you do this for a while, you'll notice that in your daily life, you will be more skilled at bringing your attention back to the moment. Long term, try to continue your daily meditation practice and think of it as something that's important for improving your mental health, just like brushing your teeth or exercising is for your physical health. So here are the resource links. I'm now going to go to each website and show you how to use them. So the first resource I'm going to show you is Palouse Mindfulness, and this is created by Dave Potter. This is a very comprehensive website that not only explains how to practice mindfulness and gives a lot of meditations to do so, but it actually includes a totally free manual that is based on a week-by-week course to practice this. So if you're interested in a very structured approach to learning mindfulness with several goals and several reading materials to meet, I really recommend this website. I also think that the Raisin meditation is one of the best ways to start mindfulness. So if you click on it, it will take you to a YouTube video where you will see the actual meditation in practice. The next website I want to show you is UCLA Health. This website has several meditations in many different languages and also transcripts available for each meditation. As a note, these meditations are often listed from easiest to most difficult. I recommend starting with a breathing meditation or a body scan. Third website is the Free Mindfulness Project. These are totally free meditations, and there's quite a few here if you want to explore them. I recommend once again starting with one of these breathing activities. And again, these are listed from easiest to most challenging. So the goal of cognitive behavioral therapy is to explore and understand the relationship between thoughts, our feelings, our behaviors, and sometimes even our physical sensations. And we can do this by working on worksheets or even talking to a counselor. In order to challenge our thoughts, we first have to recognize them and identify them in a given situation, understanding and noticing when our thoughts are unhealthy or distorted. Once we do this, simply being able to label a thought may be enough to reduce the power that this thought has over us. Sometimes just recognizing a thought isn't enough. So cognitive behavioral therapy helps us then actively challenge those thoughts before they have an impact on our mood, on our behaviors, or on how we feel. The resources I've attached are going to show you how to actually do this. So what I do is I recommend accessing one worksheet or guide from the websites a week and trying to revisit this at least 2 to 3 times a week. And also feel free to talk to your partner about this, or maybe a doctor or a friend. With time and practice, you'll find that cognitive behavioral therapy will actually help you manage these distressing thoughts when they actually come up in life. Long term then, you'll only really need to reach out to these worksheets again when you feel like you're having reoccurring negative thoughts, or when you feel like you're having thoughts that you just can't manage anymore. So here are the 2 resources. I'm now going to walk you through the websites for each of them. The first website I recommend is therapistaid.com. This website has some fantastic guides to practice cognitive behavioral therapy. So I have CBT checked on the side, and I'm also going to check adults. And when I do this, it'll filter for material that is relevant to adults only. So the guides I recommend trying are the Cognitive Restructuring Guide, the CBT Psychoeducation Guide, and the Behavioral Activation Guide. You can also access some additional worksheets on this tab, and you can go through them, but I recommend really starting with the guides to understand the principles and how to actually use these worksheets. The next website I recommend is positivepsychology.com. It has a very long and comprehensive article on how to practice these therapies and how to learn them, as well as worksheets. So you can learn about cognitive behavioral therapy, about cognitive distortions, and about how to do this. And then once you click here, they have several completely free worksheets for you to print and to use. So now that we've gone through all the websites, I'm just going to give you a few more pointers if you want to try this. So the first is to just do it. If you're interested in this but hesitant in any way, just try to look at the websites, maybe try one meditation or even one worksheet and see how you feel. The second is to start small. Try not to overwhelm yourself by doing a lot of meditation or a lot of worksheets at once. And don't be discouraged if you're not seeing any immediate benefits. The benefits come after consistent practice and mind training. The goal is to get these skills to move from your short-term memory, which is very limited, to your vast long-term memory, and then they'll become automatic. Just like riding a bike or driving a car, it simply takes practice and time for these skills to become familiar. The third is to try and dedicate time to practice. So whether you can manage to do one meditation a day, or even if it's just one meditation a week, just the best that you can do, try and at least stay consistent with it so it becomes habitual and it becomes like a practicing activity. Think of this as some sort of activity to benefit your mental health in the long run. The fourth is to try and communicate with your sexual health clinician on this, or maybe your general practitioner. They can offer you some more advice or additional resources, or they can even refer you to counselors or psychological services if that's something you also want to explore. And finally, if you are looking to apply these therapies to your sex life and intimacy, consider accessing additional information and resources on these topics. Christine Zarowski, a registered nurse at the Prostate Cancer Supportive Care Program, has 3 videos discussing intimacy and sexual function after cancer. These videos explain the important building blocks to building sexual life after cancer, and cognitive behavioral therapy and mindfulness are great to add to this. So now I'm going to introduce you to a totally fictional couple, Alex and Diane, and I'm going to show you how they use these therapeutic skills in an example in their sex life. So Alex and Diane are engaging in sexual activity after Alex has finished his prostate cancer treatments, although this can be applicable at any time in the prostate cancer journey. So Alex and Diane are very engaged in sexual activity and they're both enjoying it. But Alex starts to have worrying thoughts such as, when is penetration going to happen? Is my erection going to be firm enough for penetration? And what will happen if it doesn't work this time? Does it even count if I need to give myself a penile injection first? Suddenly, Alex is so caught up in worrying about his erections that he's no longer paying attention to the sensations of his partner's touch or the sheer enjoyment on his partner's face. His negative thoughts will cause stress and further reduce sexual function, and they'll also interfere with Diane's pleasure. So now we can approach this situation using CBT skills. Imagine that Alex notices these worrying thoughts and labels them as the thinking traps or cognitive distortions that they are, without giving much attention to them. He might tell himself, oh, there's a catastrophizing thought again, or a black and white thought too, wow, my brain is really active right now, and falling into a bunch of these thinking patterns. Because Alex is able to recognize these thoughts, he doesn't take them too seriously and he doesn't experience as much stress or disappointment, and he can focus back onto the sexual activity. In the same scenario, Alex can also practice mindfulness to help these thoughts. Just like clouds passing by in the sky, he can acknowledge that those thoughts are there and let them drift by without holding on to them. Alex then uses his mindfulness training to bring his attention back to the activities and sensations in the moment. Ultimately, by using both of these skills, Alex doesn't get caught up in his worrying thoughts, and he can focus on his own sensations as well as his partner Diane. So hopefully today you've learned that mindfulness and cognitive behavioral therapy are very useful skills that can help you change the way you cope with cancer and also help improve your sexual experiences. When building skills, you won't see immediate changes or benefits right away, but with repeated practice, you'll hopefully see some improvements in your quality of life. So the links to the resources that I've shown you today are going to be below this video in the webpage. I've also added a few extra links to books if you want to explore this further. And I'd like to thank you so much for watching this video today, and I hope you find this helpful in your prostate cancer journey. I'd also like to thank the patients that have helped me with this project. Without them, this would have never happened. And I'd also like to acknowledge and thank our funding bodies, the Movember Foundation and Vancouver Coastal Health Research Institute, as well as the University of British Columbia for their support in this project.